Okay, good morning. Welcome to the 2024 Continuum of Care General Orientation. My name is Laura Ellis Mazzaro, and I'm the CoC Manager at Strategies to End Homelessness. Joining me in presenting is Kevin Finn, our Executive Director at Strategies, as well as Kira Reitzman, who is new to our team as the CoC Coordinator. So Kira will be taking minutes and monitoring the chat and questions. If you have any questions throughout the presentation, please either ask them in the chat or raise your virtual team's hand. Kira will stop me throughout the presentation if questions arise, or you could always hold them until the end if you feel more comfortable. This meeting is being recorded and it will be posted on the Strategies YouTube channel. That does take some time, but it'll be there soon. I'll provide a copy of the minutes, the PowerPoint, our CoC timeline, and intents to apply documents to all who registered or attended after the call. So this orientation was designed for new staff at existing CoC and ESG funded agencies, as well as staff who just are interested in a refresher. It's also designed for organizations interested in applying for funding or organizations and individuals interested in participating in the CoC work. So thank you all for attending, and we greatly appreciate you taking time out of your day to learn more about the CoC. On the screen, you will see our agenda for today. I did make a couple of revisions since I sent it out. We're going to be going over what is a CoC and the history of our local continuum of care. We'll go over the CoC program and purpose, CoC structure and responsibilities, what are eligible project applications and activities for CoC funding, the populations that the CoC serves, and then we'll talk about the CoC application and annual funding cycle and local timelines regarding that cycle. Again, you can ask questions at any time, but we will leave time at the end for questions as well. So I'm going to hand it over to Kevin to talk about what is CoC, what is the continuum of care for the homeless.
Thanks, Laura. Again, I'm Kevin Finn. I'm the president of Strategies to End Homelessness. So for those of you who are not new, bear with me for a second because you probably heard this before, but for those of you who are new, I think there's a lot in these first couple slides that sort of sets the table for what we're talking about today. So we're talking today about continuum of care funding and what is a continuum of care. So the quote on this slide comes directly from HUD, which is the funding source for the CoC. And I think there's a lot alluded to in this slide that we're going to get into in more detail as we go along this morning. So a continuum of care is a community plan. So what HUD is looking for is a lot of community involvement in how your local homeless services is run and a lot of participation from different entities in the community. We'll get into more of that later. To organize and deliver housing and services. So continuum of care programs fund housing with services or supportive housing. This is not the funding source for emergency shelter. This is not the funding source for homelessness prevention. This is housing for people who are already homeless. So, which is why it says to meet the specific needs of people who are homeless. So, depending on what your organization is interested in funding for, again, this is not where we have resources available for emergency shelter operations or for homelessness prevention. This is to provide housing and services to people who are already homeless. Then I think the other perhaps most significant thing about this is the goal from HUD is to move people to stable housing and maximize self-sufficiency. So CoC funded programs are very different than something like the Housing Choice Voucher Program or something like that, in that these programs are very much targeted at moving people along and out of homelessness and out of the system, as opposed to maintaining people or keeping them comfortable in their homelessness or something like that. These are the resources that are to exit people from homelessness and to self-sufficiency. Next slide, Laura. I'm going to spend just a second. The term continuum of care gets thrown around in a number of different ways. So I think it's important to clarify what we're talking about, that the term COC or continuum of care, or the long version continuum of care for the homeless, means a couple different things. It is a program from the U.S. Department of Housing and Urban Development. So it is a funding source that is available, but it is also a structure, and we're going to spend a significant amount of time today describing that structure to you. So as a point of reference, there are 400 continuums of care in the country. There are 9 just in the state of Ohio. Ours is the Cincinnati Hamilton County Continuum of Care. And there is a certain structure that is required to be in place in order to get these HUD dollars. So we're also going to outline for you some of that structure. Next slide. To give you all just a little bit of history of sort of how we got to where we are, and I don't know that we've shared this necessarily with everybody in years past. So it was 1995 when HUD began the Continuum of Care for the Homeless program. And that's when they began requiring communities to organize themselves into those structures, also referred to as continuums of care, if they wanted to get the funding. Back then in 1995, the city applied for the funding and did not receive it. So beginning in 1996, and back then the continuum of care was very much a once a year application that went into HUD. The agencies would come together and participate in putting together that application for over the course of about a month. But the other 11 months of the year, the agencies didn't necessarily coordinate their work at all. So in 1996, the city contracted with the Partnership Center, which is a company I think probably many of you have heard of, to put together that annual application to HUD on behalf of Cincinnati and Hamilton County. One of the things the Partnership Center did when they started putting the application together was they put together an advisory committee that was immediately began being referred to as the Homeless Clearinghouse. That group still exists, as we'll talk about. I myself joined the Homeless Clearinghouse for the first time in 1998. And that was the group that was providing advice to the Partnership Center in terms of how to put the application together. So from 1996 to 2007, the application for our continuum, Cincinnati Hamilton County, was put together by the Partnership Center with guidance from the Homeless Clearinghouse. Next slide, Laura. 2006, there was significant legislation proposed at the federal level that really revamped the whole continuum of care program and made it really much more of a year-round process and collaboration the way it is today. And that legislation was known as the HEARTH Act. And one of the requirements of the HEARTH Act was that the funding was overseen by a nonprofit or a unit of local government. And there was an additional requirement that you have what was called a Continuum of Care Board. So the decision that was made locally at that point by the Homeless Clearinghouse, our advisory group, was to incorporate our very much community-based continuum of care processes and structure into an organization, and for the Homeless Clearinghouse to become the CoC board that HUD was at that point then requiring. So that was sort of the impetus for the structure that we have now. The Homeless Clearinghouse became the CoC board and sort of blessed the formation of a new nonprofit organization that was intended to run the continuum of care for Cincinnati Hamilton County. So the name of that organization at the time was the Cincinnati Hamilton County Continuum of Care for the Homeless, Inc. So then in 2012, which is the predecessor to Strategies to End Homelessness, in 2012, because God knows Cincinnati Hamilton County Continuum of Care for the Homeless, Inc. was way too long of a name, and because we were doing lots of other things as well, In 2012, we changed our name to Strategies to End Homelessness. But I think what's important for you all to understand is, we have for a long, long time had a community-based process overseen by an advisory group made up of the relevant agencies in our continuum. And even the very existence of Strategies to End Homelessness was a decision made by that CoC board, that this was the way our community should move forward. And we remain both the lead agency for the local continuum of care, and our CoC board to this day is known as the Homeless Clearinghouse. So that's just a little bit of history for you in terms of how we got to where we are. And when you know one continuum of care, and as I mentioned, there are 9 in Ohio, 400 nationally, when you know one, because they're all structured a little bit different. They all operate a little bit different. Ours is very heavy on the community participation side, which is good, in at least this one man's opinion. So, okay, so a little bit more that I'm going to cover, and then I'm going to turn it back over to Laura. A last little bit of information directly from HUD, and I think you'll see these elements in some of the detail we're going to get into later. So this is the CoC program and purpose. Community-wide commitment to ending homelessness. So these are not dollars that are maintaining homelessness. They're not making it comfortable. They're not making it okay for people to be homelessness. These are dollars that are ending homelessness. The commitment is to quickly rehouse families, and that's what these dollars really pay for. HUD is very big on not paying for 100% of anything, so they want to see that people being served in these HUD-funded programs are being connected to other resources that are publicly available, other mainstream resources, and other resources that optimize self-sufficiency. So like when we get into, for those of you who will also be attending the scoring event, you'll see like this is where a lot of the outcomes that programs funded with these dollars are being held to. This is where it comes from, because HUD wants to see that we're ending homelessness, that we're quickly rehousing people, that they're getting connected to other resources that are available, and in total, that we're moving them towards self-sufficiency. So that is the background I wanted to share with you all. And now Laura's going to get into a little bit more of what that structure actually looks like.
Thank you, Kevin. It was a very last minute this morning decision to add those history slides. I think it's always important to see where we started, so I appreciate you taking that on for us. So thank you. Okay, so the CoC is the group responsible for carrying out the duties defined in the HUD CoC's Continuum of Care interim rule. The CoC is composed of representatives of relevant organizations within the geographic area. I oftentimes get questions like, what are the fees to join the CoC? There are no fees to join the CoC, aside from a commitment to collaboration with other partners that serve people experiencing homelessness. So by attending the meetings, by providing your input, you are a member of the CoC. By receiving funding, you're a member of the CoC. The CoC appoints a CoC board, HMIS lead agency, and a collaborative applicant to assist with the CoC's responsibilities. The CoC board, as we previously mentioned, locally known as the Homeless Clearinghouse, is the group appointed to act on behalf of the CoC. The clearinghouse is made up of representatives of the relevant organizations and of projects serving homeless subpopulations. It includes at least one person with lived experience of homelessness. This is a requirement by HUD. Our board, as of last year, has 3 designated seats for people with lived experience of homelessness. The CoC board develops and drives the CoC strategic plan and governance charter, and votes on policies, funding, and other CoC areas of concerns. If at any time there is a perceived conflict of interest of a clearinghouse member, they are required to recuse themselves from voting. So our CoC currently has 28 seats. If you recall what Kevin said in the beginning, in 1996, the clearinghouse had only 4 seats. So we have grown quite a bit. So on your screen are a list of the seats. Since the city of Cincinnati and Hamilton County are still on our clearinghouse, like I said, we have 2 lived experience seats. Those 2 seats are nominated by the Homeless Coalition. We have the Homeless Advocate seat, Healthcare for Homeless. The Housing Authority is on our board, a Victim Services Provider, Veteran Services, Education Liaison, ESG, which stands for Emergency Solutions Grant Shelter, Emergency Solutions Grant Shelter Diversion seat. We have 10 CoC work groups. Those are the homeless outreach groups. So that's primarily looking at unsheltered homelessness and street outreach. The emergency shelter work group, coordinated entry, which we'll talk about later, rapid rehousing and transitional housing, permanent supportive housing, homeless families, youth homelessness, veteran homelessness, racial equity, and people with lived expertise of homelessness. So that is our 3rd designated seat for people with lived experience. We have 3 seats dedicated to CoC funded executive directors and 1 seat to non-CoC funded executive director. The public library is a new seat on our clearinghouse. They are now involved with the board, and the UFA HMIS lead. So each clearinghouse member is nominated by a group and approved by the clearinghouse. You'll notice that there are no agency names listed in this list, and that is because each clearinghouse member is representing the constituents of the seat they hold, not their agency. So if you are interested in becoming a CoC board member, you must be nominated and approved by the clearinghouse, and the best way to do that is to attend one of the work group meetings listed or a clearinghouse subcommittee, which I'll go over in the next slide. Work groups, aside from the people with lived expertise of homelessness work group, are open to the public. Anyone can attend these work groups. The people with lived expertise of homelessness work group is only open to those who have actually lived experience of homelessness. And this creates an environment that is comfortable and safe to speak openly about experiences without fear or stigma of retaliation. So if you have experienced homelessness in your past, you are welcome to join the people with lived expertise work group. However, the public, it is not open to widely to the public.
Hey, Laura, if I might jump in for a second, I
Go for it.
would, you were talking before about what makes somebody a member of the continuum of care. I mean, I feel like every organization should, at minimum, be participating in one work group. So to me, that's the sort of base level of being a part of the collaboration that is our continuum, is that your organization is a part of at least one of those work groups. I do also think it's worth noting as well that, like, hey, if you want to be in charge of our local system, then join a group, become the chair, and all of a sudden you're one of the voting members on the Homeless Clearinghouse making the decisions. I always like to point out that in this graphic, strategies to end homelessness, we're sometimes perceived as being in charge of all this stuff. We have one vote. So any person in our continuum, by representing a work group and having a seat at this table, could have just as much of a vote as we do in terms of guiding the system and determining what we should be doing as a system to help people who are homeless. So I think, and I mentioned that I first joined the Homeless Clearinghouse in 1998. I was the chair of the homeless outreach group at that time. So that was how I first came to be there. So anybody who wanted to help with leadership in that way could become a member of the Homeless Clearinghouse.
Thanks, Kevin. Yeah, and you do not have to be, again, I'll reiterate, you do not have to be funded through CoC funding or emergency ESG funding to attend or chair a work group. There are work group chairs who do not receive, their organization that they work for does not receive CoC or ESG funding. So I wanted to throw that out there as well. Thank you. All right, we have quite a few subcommittees of the clearinghouse, and I know this is super small font, so I apologize, but an asterisk next to the subcommittee denotes that this is a closed group, meaning members must be nominated and approved by the clearinghouse. All other subcommittees, however, are open to the public. Anyone can attend. So the first one we'll talk about is steering team. That is closed. This group serves as an executive team of the Homeless Clearinghouse and sets the agenda for meetings as well as other duties assigned by the CoC board / Homeless Clearinghouse. The scoring subcommittee is open. So I think Kevin mentioned later this afternoon, we're having a scoring explainer event. That is the product of a full year's work of the scoring subcommittee. So the scoring subcommittee reviews the process our COC uses to prioritize projects for COC funding and recommends improvements to the homeless clearinghouse. It also reviews community data to best inform prioritization and how to improve community performance. The monitoring subcommittee is the only other closed group of the subcommittees. So the monitoring subcommittee oversees the COC and strategies monitoring process, um, which we'll talk about later, and it ensures consistency and reasonableness. Sometimes the monitoring subcommittee will recommend a sanction to be considered by the homeless clearinghouse. The appointments subcommittee are typically members of the clearinghouse, but it is open to others. But they review performance of our appointed entities. So that's like the, we're going to talk about it later, but the HMIS lead agency, our HMIS vendor, the collaborative applicant. So the appointment subcommittee reviews their performance and functions as it's listed in the governance charter to recommend reappointments, improvements, or changes. The match subcommittee. So this subcommittee is all about what's called match. So HUD requires COC programs to match funding received by HUD 20% of their award. So they're required to match 25% of their award, aside from leasing, which we'll go into details about that later. But this subcommittee is working on strategic and creative ways to meet match and the regulations around match for HUD so that it's not so burdensome on the agencies receiving funding. The Property Owner Engagement Subcommittee develops property owner recruitment strategies, including the implementation of PadMission, which is a software that we use in our system to connect those experiencing homelessness in a housing service project to property owners. This subcommittee also identifies methods to incentivize partnerships with property owners and plan recruitment events. The Advocacy Subcommittee, it's exactly what it sounds like. It works to advocate for the homeless system as identified through strategic planning. They're currently mostly focused on the Affordable Housing Trust Fund, but there are other advocacy work that they've done with the Housing Authority and HUD and other tasks assigned by the clearinghouse. And our newest subcommittee that hasn't even had a meeting yet, so if anyone's interested, please let me know and I'll invite you to our next meeting, is the Data and Communication Subcommittee. We had this subcommittee years ago. There wasn't a ton of interest. It kind of died down, but we're bringing it back. So this subcommittee is going to be analyzing system-wide data and develop plans to communicate that data to the wider community on behalf of the COC board. Okay, so now that we know what a COC is, we're going to review the responsibilities of a COC. So a COC is required to designate and operate the Homeless Management Information System, also known as HMIS. So this is where the homeless and housing services, they input data on those experiencing homelessness into the system. It is private. You cannot access the system without approval by the board and by the COC and by the HMIS lead. So currently, our community utilizes Clarity by BitFocus as the vendor of our HMIS. Some partners may use other data systems and transfer data electronically into Clarity, but all HUD-funded agencies are required to have data in the COC's HMIS, which is Clarity, either by direct data entry or import. We have to upload a lot of data. We're in the midst of it right now with the HIC and the PIT. We have to upload a lot of data into HUD. So it is required that everyone participates. The COC also designates the HMIS lead agency. This is currently Strategies to End Homelessness. The HMIS lead agency is appointed by the COC board to oversee the day-to-day operations of the COC's HMIS, which is BitFocus by Clarity, or Clarity by BitFocus. And it's designated to operate and administer HMIS on the COC's behalf. So all COCs are required to designate a collaborative applicant to to submit the CoC registration and consolidated application on behalf of the CoC. So a collaborative applicant can apply to become what's called a Unified Funding Agency, or UFA. However, it is very rare, less than 1%, that a collaborative applicant is awarded UFA status. UFA status allows for additional flexibilities, for example, shifting or reallocating funds amongst CoC subrecipients within the CoC. If you're not a UFA, you don't have a lot of those same flexibilities. Strategies to End Homelessness was awarded this status by HUD, therefore is not only the designated collaborative applicant, but also a UFA. So, like I said, the collaborative applicant applies to HUD for funding for all projects within the geographic area, and the collaborative applicant, or UFA, enters into a grant agreement with HUD. Strategies then enters into a legally binding agreement with subrecipients and receives and distributes funds for all projects within the geographic area. Strategies also monitors subrecipients for performance and compliance, and works with the CoC board to make decisions on overall grant management and changes, as well as other responsibilities that are in our governance charter. The CoC is required to operate a CoC, and what that means is develop written standards in consultation with ESG recipients to prioritize individuals and families eligible to receive the assistance and the amount and type of assistance they should receive. The CoC must establish performance expectations and monitor individual projects and system performance. So project monitoring, there's different various ways that projects are monitored. Strategies reviews funding reimbursement requests monthly. Agencies contributing to the HMIS are required to monitor the HMIS data monthly. And then all CoC and ESG funded programs are monitored by Strategies annually. And that annual monitoring consists of financial policies and transactions, program policies and participant records, HMIS data quality, privacy, and security. So the CoC also must develop a housing and service system, design and follow a collaborative process to select projects to apply for CoC funds, collaborate on reporting and evaluation of ESG funded projects, and participate in the City of Cincinnati and Hamilton County's consolidated plan process. Each CoC is required to develop and implement a centralized or coordinated entry system for its geographic area. If you receive or are interested in applying for CoC or ESG funding, you are required to accept all referrals for that project being funded through the coordinated entry system. So you cannot accept referrals for the project being funded by CoC or ESG funds from any other source, including internal sources outside of the coordinated entry system. So if you're operating an emergency shelter and a permanent supportive housing project, you can't just transfer somebody from your emergency shelter into your PSH, your CoC funded PSH project without going through this prioritization system. You also have to accept referrals outside of your emergency shelter project through the coordinated entry system. This is a regulatory requirement. This isn't a community requirement. So our coordinated entry system has three components. There's the central access point, coordinated access, and coordinated exit. Central access points include the CAP line. You may have heard of that, 381 SAFE. But we also have other access points for specific subpopulations. That includes Lighthouse, Shelter House, and the YWCA of Greater Cincinnati. These points of access refer to emergency shelter services, transitional housing, street outreach, homeless prevention and shelter diversion projects, and homeless veteran services. So the central access point does not only refer to CoC, or coordinated entry does not only refer to CoC and ESG funded projects, they refer to a plethora of other projects. Once connected to shelter or street outreach, a common assessment tool is completed with every person experiencing homelessness to prioritize them for rapid rehousing or permanent supportive housing based on risk, barriers, and needs identified through the Common Assessment Tool. Our community is currently piloting a new tool called the CHAT. It's the Cincinnati Housing Assessment Tool. In order to access rapid rehousing or PSH, they must go through the coordinated assessment process. The third component of the coordinated entry system is coordinated exit. This is when a person currently experiencing homelessness who does not have the need of ongoing supportive services but would benefit from a subsidy, or a person stabilized in a rapid rehousing or permanent supportive housing project but still in need of subsidy, can be referred to CMHA for a housing choice voucher. CMHA sets aside 1,150 vouchers annually for those in the homeless system, which has grown exponentially over the years. I think back in 2020, it was around 750. Although CoC and ESG funded projects are required to utilize the coordinated entry system, other projects not required to utilize the coordinated entry system have opted to be integrated into our coordinated entry system, either at the CAP level, coordinated assessment, and/or coordinated exit, making our coordinated entry system a more effective referral and prioritization source for the entire homeless services community. So for example, there's some like veterans projects not required to be a part of coordinated entry, but are a part of the CAP point and the coordinated assessment and coordinated exit. It is the responsibility of the CoC to operate under research-based best practices. The CoC and CoC board are continuously working to implement research-based best practices, and it is currently on the strategic plan to expand our research-based best practices. However, on the screen, you'll see our 4 primary best practices the CoC operates within, which are trauma-informed care, housing first, harm reduction, and motivational interviewing. I'm not going to read through each one just to save time, but I'll give you a second to look those over. Earlier, Kevin differentiated between the 2 types of ways we use the term CoC. We just went over the structure of a CoC, but now we're going to talk about CoC used to describe the funding our community receives from HUD to operate homeless service projects, housing projects. So this upcoming fiscal year to start on July 1st of 2024, our CoC was awarded over $28 million in CoC funding. So we're going to talk about who is eligible to apply for CoC funds and how to apply for them. So in order to be eligible to apply for CoC funds, a project must be a nonprofit, be designated by the CoC to apply for funds. New applicants can only apply for current CoC eligible components, which are PSH, rapid rehousing, and joint transitional rapid rehousing. We're going to go into detail on what each of those are. Transitional housing, supportive services only, and homeless prevention are currently not eligible for CoC funding. Other considerations when applying for CoC funds, an agency should have an accounting system that produces budgets and financial statements, conduct a financial audit, and must provide match funding. So that's 25% of funding received aside from leasing funds. Okay, so permanent supportive housing, PSH. So PSH is permanent housing in which housing assistance, which is long-term leasing or rental assistance, and supportive services are provided to assist households experiencing homelessness with at least one member, it could be an adult or a child, with a disability in achieving housing stability. Households experiencing chronic homelessness are prioritized for PSH. So in our community, there's 2 types of PSH. We have site-based and scattered site PSH. So it's pretty much what it sounds like. Site-based PSH, the participants live in the units in a building that the housing program owns or master leases. Support services are located on site, either case management, but some of our buildings include nursing or health care, education and job training, youth and child programming, and food security support, as well as other supportive services like mental health services, substance use, etc. Scattered site PSH participants obtain and pay for private market housing, not necessarily owned or master leased by the housing program. So that's where that PAD mission comes in, where we connect folks experiencing homelessness with property owners in the community. That would be within scattered site PSH. Supportive services are not typically offered on site. However, they're often provided through home visits. So a case manager may not have an office on site at a building where scattered site PSH is, but they would be required to do home visits. Rapid rehousing is permanent housing that provides short-term, up to 3 months, and medium-term, 4 to 24 months, of tenant-based rental assistance and supportive services to households experiencing homelessness. Again, this is like a scattered site approach. HUD does not require an individual to have a disability to qualify for rapid rehousing. Something newish to our community is rapid rehousing progressive engagement. This is a best practice of rapid rehousing. So if you're applying for funds and you want to have a progressive engagement program, you would apply for rapid rehousing. It's an approach to assist households experiencing homelessness as rapidly as possible, despite barriers, with minimal financial and support services. We call it light touch services. Through regular reassessments, more supports are offered to those households who struggle to stabilize and cannot maintain their housing. So typically they may be in the project for up to 6 months, but as they're in this project, the provider is reassessing constantly where that person is, and they can either extend them in the project for up to 24 months, or it may be determined that they need a permanent supportive housing transfer. They can also exit successfully or to a CMHA voucher. But the idea is that you wouldn't prescribe a 24-month rental assistance to every person coming into your project, or even a 12-month. So we currently have 2 projects in our community operating progressive engagement with a strategic planning goal to expand. Next is transitional housing and transitional housing rapid rehousing joint component. So transitional housing is not by itself is not eligible for CoC funding. Transitional housing provides temporary housing with supportive services to individuals and families experiencing homelessness, with the goal of interim stability and support to successfully move and maintain permanent housing. Transitional housing projects cover housing costs and accompanying supportive services for program participants for up to 24 months. We do have transitional housing in our community. It is not CoC funded. What we do have that is CoC funded is this joint component, which is a newer type of project since 2017. This combines the activities of transitional housing and rapid rehousing. So these projects provide a safe place for people to stay, which is the transitional housing component, with financial assistance and wraparound supportive services determined by program participants to help them move to permanent housing as quickly as possible. SSOs, or supportive services only projects, are also not eligible for new CoC funding. SSO projects allow recipients to provide supportive services such as street outreach or case management to sheltered and unsheltered families or people experiencing homelessness. The recipient may only assist program participants for whom the recipient or subrecipient of the funds is not providing housing or housing assistance. So you can't have a PSH project and apply for SSO funds. This is for only if they're literally homeless while in their SSO project. So new SSO projects are currently not permitted to apply, but our community does have 3 SSO projects that have been renewed year after year lately. So that's Shelter House's HIP project, Lighthouse's Street Outreach project, and the Family Housing Partnerships Shelter Case Management project. Coordinated Entry is also considered an SSO project, but it is HUD required, therefore it doesn't go through the same process. We've talked about homeless prevention and shelter diversion. Homeless prevention provides short-term or medium-term rental assistance and housing relocation and stabilization services for those at imminent risk of homelessness. Shelter diversion is different in homeless prevention, and that keeps households from becoming literally homeless. Oftentimes, Folks who are in our shelter diversion programs have already lost their housing and they're doubled up and running out of places to stay. They may be presenting at the shelter door, and we're able to do shelter diversion intervention so that they don't actually have to enter homelessness. Shelter diversion programs provide short-term or medium-term financial assistance and supportive services as funding allows. So some funding sources don't have a ton of financial assistance attached to shelter diversion, whereas other funding sources do. Again, homeless prevention and shelter diversion are currently not eligible CoC funded programs, but we wanted to highlight them because they do exist in our community, and we use other funds to support those efforts. Eligible costs of a CoC program. So acquisition, rehabilitation, and new construction are all eligible costs when applying for a new CoC program, but they are not renewable. You have to spend those three budget line items within your first year of operation. You cannot renew those. What are renewable are leasing, rental assistance, supportive services, operating costs, HMIS, and administration. So those are all eligible costs.
Laura, I would mention regarding, if you could go back to that last slide, because this is a question I get all the time from new agencies. Not only are acquisition, rehabilitation, and new construction not renewable, I think it's important to note what that means. Like if our community were getting $25 million this year and we spent 3 million of it on acquisition, rehabilitation, and new construction, that means next year we only get 22 million. So the reality is that projects applying for these types of dollars don't have a great chance of getting funded through our local process because it ends up reducing the amount of money we receive as a community for years going forward. So while it is an eligible activity, the net result of those expenses not being renewable is really that there's not much chance a project asking for those would get funded because it's detrimental to the overall amount of funding our community would receive going forward.
Thank you. Most PSH site-based projects that are purchasing, rehabbing, or constructing a new building, like Kevin said, they do not utilize CoC funds, even though they're eligible. There's LIHTC and other funding sources out there that they tap into. And if you're a new project or a new agency that's interested in learning more about that, send us an email and we can talk to you about other funding options. So who can be served by CoC funded programs? This is the definition of homelessness. So HUD published the final rule revising the definition of homelessness on December 5th of 2011. The definition is applicable to ESG funded projects as well as new and renewal projects funded by the Continuum of Care funds. There are 4 categories of homelessness. Currently, CoC and ESG funds in our community can only serve categories 1 and 4 of homelessness. The other non-CoC funding is used to serve categories 2 and 3. But we're going to take a look at each category anyway, even if we're not able to use CoC funds for them. So literally homeless is, this is someone who sleeps in an emergency shelter or a place not meant for human habitation. For example, a car, abandoned buildings, tents under a bridge, a sidewalk, things of that nature. Here's the HUD definition. So it's an individual or family who lacks a fixed, regular, and adequate nighttime residence. An individual or family with a primary nighttime residence that is a public or private space not designed for or ordinarily used as regular sleeping accommodations for human beings. Or an individual or family living in a supervised publicly or privately operated shelter designated to provide temporary living arrangements. Category 2, again, not currently eligible for CoC funding, but we do have other resources in our community. That's at imminent risk of homelessness. So that's individuals and families who will imminently lose their primary nighttime residence within 14 days. That's like really key point, 14 days. And they have no other residents identified, and they lack the resources and support networks needed to obtain other permanent housing. Category 3 is like a lot of information. So it's homeless under other federal statute. and it's complicated, and there's the definition. So they must unaccompanied youth under 25 or families with children and youth who do not otherwise qualify as homeless, but who meet the homeless definition under other federal statutes and have not had a lease or permanent housing anytime in the last 60 days and have experienced 2 or more moves in the last 60 days and can be expected to continue in such status for an extended period of time for various reasons. Category 4, this is eligible for CoC funding, CoC and ESG. So that's fleeing domestic violence. That's individuals and families who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions related to violence, including human trafficking, who have no identified residence and lack the resources and support networks needed to obtain other permanent housing. So as you may recall, PSH prioritizes those experiencing chronic homelessness. Our community prioritizes chronic homelessness in general. The federal definition of chronic homelessness is an individual experiencing homelessness with a disability and has experienced homelessness continuously for at least 12 months or on 4 separate occasions in the last 3 years. Those combined occasions must total 12 months, and the occasions must be separated by a break of at least 7 nights. Stays in institutions of fewer than 90 days do not constitute a break. So this definition, it comes up in almost every work group often. It's really confusing, but our coordinated entry system does track that information, and our shelters and street outreach workers are really good at documenting chronic homelessness. All right. So CoC and project applications. This is more of what do we look at? How do we apply? So as the collaborative applicant in UFA, Strategy submits both the CoC application and all project applications to HUD. So there is a difference between the CoC application and the project application. The CoC application encompasses everything the CoC does and produces year-round. There is a lot of narrative, a lot of explanation of the scoring process, our prioritization process, our work groups, our system performance measures. There's narrative around racial equity, how we include people with lived experience into our processes, our CoC board. There's a governance charter. There's so much that goes into the CoC application about our system. It's written by Strategies and reviewed by the Homeless Clearinghouse. It's posted annually for public comment prior to submission, and is scored nationally by HUD in Washington, D.C. The project application is information provided by agencies requesting new or renewal grants in partnership with Strategies. So Strategies reaches out to those projects, and they submit an application and work collaboratively to make sure that that application meets the requirements of HUD. It is submitted by Strategies and must pass a capacity review conducted by the HUD field office. This is also scored nationally by HUD in Washington. So how does a project get into our CoC application in HUD? So all projects must meet threshold requirements. They must be a nonprofit, like I said, with an accounting system and conduct a financial audit. The match funds is really crucial. So all funds except leasing must provide 25% of cash or in-kind match. So in-kind match is like services provided either internally or externally with a dollar value. Eligible activity, it must be an eligible activity and project component, which we already discussed. You must participate in HMIS and the coordinated entry system. This is new this year, you must meet the Housing First Fidelity Threshold score of a 6. New projects must schedule a meeting with Strategies. 60% of funds must have a housing focus and have established healthcare partnerships. New agencies must undergo a risk assessment. And just FYI, HUD gives 10 additional points for new rapid rehousing projects. So HUD is prioritizing rapid rehousing projects. We still will take new applications for PSH, but just keep that in mind that there is 10 additional points. Pre-measured elements are based on a variety of performance outcomes, grant management, data quality, CoC participation, racial equity, and more. So existing elements are reviewed and new elements are developed in the scoring subcommittee throughout the year and approved by the clearinghouse annually. These pre-measured elements are for the renewal projects only. Again, there's an explainer event this afternoon. If you didn't get a link, please email me and I'll get you the link. Those pre-measured elements include expending grant previously. So if your renewal project is underspent, they must follow the local expenditure threshold policy, which may include a reduction in funding if you are underspent. CoC scoring criteria, outcomes matter in this pre-measured elements. When you are renewing your project, your outcomes matter. If a project is ranked in the bottom 15%, so you're scored against, the renewal projects are scored against each other. If you're ranked in the bottom 15%, you are required to present at what's called the community prioritization event. This is where the community's perception of the value of the program comes into consideration when ranking you in the final ranking that is submitted to HUD. So the bottom 15%, new projects, and new this year, SSO projects that do not meet a scoring threshold will be required to present. More information again this afternoon. All right.
Hey, Laura.
Yeah.
Sorry to interrupt.
No, go ahead.
You'll be sharing these slides with everyone, correct?
Yes. Thank you. Strategy submits system performance measures annually to HUD, and HUD uses this in collaboration with other reporting requirements in the narrative from the application to determine funding needs. So many of the measures determined to be scored in the pre-measured elements section that I just described in the previous slide are based off of system performance measures, as well as past NOFO application questions and community and strategic planning goals. So our CoC system performance measures that we report to HUD and that impact our CoC application include the length of time persons experience homelessness, the extent to which persons who exit homelessness to permanent housing destinations return to homelessness, we call that recidivism, number of persons experiencing homelessness, employment and income growth for persons experiencing homelessness in CoC program funded projects, number of persons who become homeless for the first time, and successful placement from street outreach and successful placement in or retention of permanent housing. If you join the explainer event this afternoon, we'll actually be going through how we're doing compared to the national averages in our community. All right, so the CoC funding cycle, we're actually doing really well on time. So intent to apply for new funding documents have been distributed and are posted on the Strategies website. You will be receiving, the intent to renew funding was also sent directly to leadership of renewal organizations along with the Housing First questionnaire. There were a couple of agencies that reached out. They did see an error in the Housing First questionnaire. So I will be sending out the new versions today to those who haven't received the new versions yet. I will be doing that after this call, and we'll be reposting on Strategies website. After this call, I'll be sending that information to you as well. All projects, both new and renewals, are required to submit one intent to apply or renew and one Housing First questionnaire for each project that they're applying for. These are due by June 3rd, 2024. All new projects will be required to meet with Strategies by June 25th of 2024. This is all projects. So even if you are an existing funded agency, if you are applying for a new project, you still have to meet with us to discuss your project and make sure that it's in compliance and meeting all of the thresholds. Submission of an intent to apply or renew and or a project application does not guarantee you will receive funding. All applications and funding amounts must be approved by the CoC board prior to entry into the application and by HUD prior to award. The community prioritization event will be held in person this year. So I want everybody to note this is the first time I'm saying this out loud. The community prioritization event will be held in person for all presenters and scorers this year. So if you're in the bottom 15% of the renewals, if you did not meet your 60% threshold as a supportive services only project, or if you're applying for a new project, you will have to present in person on August 14th, 2024. It's from 9 a.m. to noon. The location, we're finalizing it, but pretty sure we know where we're going to have it. I'll release that as soon as it's finalized. We'll have an option, and if you're going to be scoring, so Even if you're not applying for funds, you could score applications, and we really welcome anyone, especially those not applying for CoC funds, to participate in the scoring process. That is on August 14th from 9 a.m. to noon. You do have to be there the whole time. You do have to be in person if you'd like to score, but that's where you'll be hearing the presentations of those three categories: new, bottom 15%, SSOs that didn't meet the scoring threshold. So yeah, August 14th. We will have a hybrid option for those who want to observe the scoring process or the prioritization event, but not participate as a presenter or scorer. Okay, the project application is submitted in the fall of 2024. We do not have the date where that application is due just yet from HUD. That'll be submitted by Strategies, or the project applications are submitted to Strategies. The CoC application by Strategies is also in the fall of 2024. Award notices from HUD likely occur in early 2025. So this is for the next funding cycle. Issues and conditions are distributed usually in spring of 2025. So many of you who are renewal CoC project have already received those for this coming year. Match funding MOUs must be submitted to Strategies prior to the July 1st, 2025. And for this upcoming scoring subrecipient cycle, the term is July 1st, 2025 to June 30th, 2026. So if you're applying for a new project this year, that you are approved for a new project, your agreement will go into effect July 1st of 2025. Monitoring visit, it's an annual visit during your contract term. Those vary from agency to agency. And our annual performance report that Strategies submit is due to HUD in September of 2026. I think it's supposed to be 2025. Here is a sample of the timeline. Again, this is all of the crucial dates. It's posted on our Strategies website, but I'm also going to be sending it out after this call to all who registered or attended. Here, it's 2 pages, pretty long. Okay, so just a reminder, a copy of the minutes, the PowerPoint, the CoC timeline, intents to apply for funding, housing first questionnaires, all of that will be distributed to you all who attended or registered to today's orientation. We are recording this presentation and it will be posted on Strategies YouTube website very soon. So do we have any, I know we didn't get a ton of questions, no one interrupted me. So do we have any other questions that anybody has about what a CoC is and the process of the CoC process? Yeah. We got a shy bunch. If you end up having a question later, you can either email the NOFA's email address on the screen, or you can email me directly. There's my really long email address, whatever's easiest for you to remember. You could also visit our Strategies to End Homelessness website. When I send out this PowerPoint, the links will all be there for you where you can click on it. I just want to thank you all again for the work you do all year to serve those experiencing homelessness in our community. We know this work is not easy, and your passion and compassion does not go unnoticed. So Kevin, do you have anything else you want to add?
Well, I was just going to mention that, HUD gives us these requirements such as having a coordinated entry system and that, but they don't dictate every detail of how it gets implemented locally. So a lot of what has been described is taking a federal government requirement, but then figuring out through our work groups the best way to implement that requirement locally. So it definitely has a sort of local flavor to it. And as I mentioned before, as a result, when you know one continuum, you only know one continuum. So if people have any questions about, where some of the different things come from, what exactly is the federal requirement? How did we develop the system for doing it locally? And that, just let us know and we can explain those sorts of things to you. But, most things about how the system works is a local community-based process for figuring out the best way to implement a federal requirement. And all of this only works because agencies participate. So thank you all for being here and for participating, not just in meetings like this, but in the work groups and so many other things.
So if you're interested, I know we went quickly through the subcommittees and the work groups. If you're interested in attending any of those, just reach out to me and I can send you the link to the meetings. Most of them are virtual over Teams. Some of them are in person, but it's primarily virtual. If you're unsure where you or your organization fits in the work groups or subcommittees, I've walked other organizations through that. You could come to all of them, but I know you don't have time to come to 10 work groups in a month and 10 subcommittees. So sometimes it's easier to just walk through it with someone and talk about what are the options and how does it make sense where you fit. So just let me know and I can walk anyone through that. And otherwise, go ahead, Kira.
We have two questions in
good.
the chat for the explainer this afternoon. Could we share a link or did you have to pre-register?
Who asked that?
Rena?
Rena, I'll send you the link.
Okay. And then Angela asked, she missed Kevin's part and wondered if this is something she can use for her nonprofit work or does her work need to apply for this funding?
The way I would respond to that, I think it's important this is an incredibly good resource for providing housing to people who are homeless. But, one of the big things I always hit on when I get calls from people is, one, it's a very narrow definition of homeless, as Laura described when she went through the categories of homelessness. So if people are already running programs, it's important that they look at that criteria to see, is everyone they're serving meet that very narrow definition of homelessness. But the other blunt way of describing the coordinated entry requirement is you don't get to pick your clients. The homeless people across the entire county get prioritized for these programs. So when you have a vacancy, the coordinated entry system gives you your next resident. You don't get to hand pick your clients. So I think that's the more blunt way of describing the effect of coordinated entry. So when people are looking for additional resources to serve the people they're already serving, no, because you don't get to hand pick your own clients.
And like I said previously, if you want to submit an intent to apply by the deadline of June 3rd, and you're still unsure after going through this orientation, you are required to have a meeting with Kevin, me, and a few others from Strategies. And we can talk you through that. We've had many times where someone's applied and they're like, oh yeah, that doesn't really fit with what I'm doing, and did an intent to apply. So they don't go through the full lengthy process of a full application. And then we've had others that have decided to move forward. So it just really, if you're still not sure and you send emails and we're still not answering your questions, submit an intent to apply.
Since we're getting done early, if people want to hang up, if there are people who have questions and want to stay on the line for a few minutes, we can do that as well.
That's a great idea. So if anybody is interested in applying a new agency, you can stay online as well. Thank you. Any other questions? Okay, thanks everyone. Have a great day. I'll see some of you this afternoon at the Scoring Explainer event for all renewal projects. It's at 1 o'clock. If you need a link, let me know. And if anybody wants to stay on, Kevin and I will stay on for a few minutes to answer any other questions. Thank you.
Hey, Laura, in the category of things that are slightly odd, I declined the invite to the